So I'm a neurosurgeon at Washington Hospital. I've been practicing neurosurgery for the past 20 years now. My main focus has always been minimally invasive surgery.
I have a high tolerance for pain, so I put up with a lot of pain, but I could no longer do things.
Patients really need to understand that if they have difficulty with standing or walking, they get better with sitting, or they've got pain that's not going away with standard therapies, then some minimally invasive spine surgery can be an option.
Since the surgery, which was last year, I have done excellent. I can't believe how I don't have pain down my legs. I'm walking, I'm doing great.
Most patients with back problems, it's a complex problem that actually worsens over age. And so typically what ends up happening is because they've got difficulty standing or walking for prolonged periods of time, oftentimes these patients with lumbar stenosis feel good when they sit down. But when they stand after 10 or 15 minutes, or when they walk after a couple of blocks, they start getting back pain, leg pain, or even numbness or cramping. And so what ends up happening is they stop being active. By freeing up the nerves, which can be done through very simple procedures, with very minimal blood loss and typically a come and go procedure, or maybe a 1 or 2 day stay in the hospital, we can get these patients up and walking again.
Washington Hospital is big with the patient-first ethic. So anytime we make any kind of decision, the first question we ask is how is it going to affect the patient? Because our patients are part of our community, which is something that we really strive to ensure that they still feel part of it even as we get bigger and bigger.
It's a whole team approach. The physical therapists are involved. The nursing care is very supportive here at Washington Hospital. Because it is a community hospital, patients have a great experience coming in and going through the recovery process here. So, minimally invasive spine surgery has had a lot of connotations in the past, but really what it involves is doing definitive operations, which are pretty standard now, but doing it through pathways where we don't have to cut normal tissue or remove normal anatomy. Traditional spine surgery always meant opening up the back and looking at the spine so we understand the anatomy very well. But now with X-ray imaging, with MRI imaging that gives us three-dimensional anatomy, and with computer guidance, we can actually do complex spinal operations without actually looking at the spine. Working through a small portal, a small tube, we can actually accomplish freeing up the nerves and reconstructing the spine or correcting spinal instability. The main advantage is that it minimizes the risk for infection, patients are in the hospital much shorter, and the recovery is much quicker. More importantly, I think it also has an impact long term. We actually get to help prolong their life.
I worked for a great company in Salt Lake called Mahler Van Lines, and I was their youngest line driver at the time. Driving truck, moving Steinway pianos. Steinway pianos are over 700 pounds. This has all led later on in life of severe back problems. I had the minimum invasive procedure done. The recovery was like normal. I'm up and about day one, walking up and down. I'm doing all those things that I've done in retirement in the past, and that's cleaning my pool, doing gardening work. I'm the guy that cleans and vacuums the house for my wife, and everything's back to normal. Dr. Kunwar has been given this gift of not only a personality that wants to better the patient, but he's been given the ability to go in and do what's best for the patient. Absolutely outstanding in his approach to caregiving.
It's incredibly rewarding when we can take a young patient and get him back to work. It's more rewarding when we can take an older patient who's in their 70s or 80s, who pretty much is sofa-bound or bed-bound or doesn't go out and become socially active because of their back pain or leg pain, to be able to bring them back a quality of life where they can get out and walk on a daily basis, they can take their dogs out, they can go play tennis again, they can walk with their spouses in the shopping mall, and it really opens up a whole new avenue for them.
When I was walking, I was having pain down my legs. The further I walked, the cramping up on my legs, sciatic nerve, everything was just taking a toll. I was on medication, and I talked to Dr. Kunwar, and the message was, do you want to live like this with pain all your life? And I says, no. He says, well, then we'll fix you. The surgery was approximately 5.5 hours. And then I was put in Washington Hospital, and they were amazing. After my surgery, they woke me up, and they says, okay, Mr. Gordado, you're ready to walk. And I didn't even think I could. And then, yeah, they took me down the hallway, and I was walking the next day. When you come to see Dr. Kunwar, He'll sit there with you and goes through everything. He'll tell you exactly what they're going to do and what to expect. He's changed my life.
I love what I do. And when you have patients sending you cards and gifts, and more importantly, when patients come back to you and say, why didn't I do this sooner? You realize that what you did was the right thing. And being able to help individuals on a daily basis, there is no better satisfaction than that.
Learn more at BayAreaHealthierTogether.com.